As U.S. healthcare expenses have increased, the investment in public health as a proportion of the total health expenditures has decreased. Presently, somewhere between 1 and 3% of all healthcare dollars spent go to public health. The 1 to 3% variation is caused by the fact that in some states, public health departments provide some primary medical care, and many services provided by primary care may be classified as public health expenditures. For example, immunizations and cancer screening. The United States spends more money per capita on health care than any other country in the world. 16% of the gross domestic product was spent in 2007. Per capita health expenditures equaled $7,290 in 2007. Of all of these expenses, only about 1 to 3% is spent on public health. In the U.S., we spend almost all of our healthcare dollars treating these diseases and very little on public health prevention strategies. If we choose not to prevent these chronic diseases, we must continue to invest in the services like immunizations, communicable disease control, and environmental health that will re-emerge as significant problems if public health efforts are curtailed. Unfortunately, these investments are not occurring. Here are the leading causes of death in the United States in 2006. Investments in public health are the only way to impact the underlying causes of death in the U.S., but sadly, these investments are not occurring. According to the World Health Organization, the United States has the highest rate of healthcare expenditures in the world, but only the 72nd best outcomes. This is further evidence that spending on medical care does not improve the health of the population. The only way to improve population health is to spend more on public health. The greatest challenge facing public health managers is that currently, as medical care expenses increase, public health expenses decrease. Even among the world's most developed countries, the U.S. invests 45% more than the next highest country. The fact that the U.S. spends so much on medical care and so little on public health puts enormous pressures on public health managers to manage these scarce resources, to secure additional funds to meet increasing demands, and to hold on to the tremendous gains that public health has achieved. Financial management skills, including not only the ability to manage funds, but also to secure new dollars, may be the most important skills a public health manager has. First and foremost, managers have to be flexible and watchful. In this environment, money is so very fluid. Knowing how to manage the money also means knowing how interchangeable it is and what you can and cannot do with different types of funds, the timelines, and how to ensure that you do not give money back or lose money due to oversight on proviso mandates. Challenges for public health include the huge budget cuts that come and go, how they are going to be taken, either across the board or specifically by program, what additional damage will potentially be coming as a result of loss of federal dollars that support state programs that will no longer be coming, and just the day-to-day increase in costs of things like travel and general operating expenses.